Hello, everyone, and welcome to World Schema Therapy Day. I'm Wendy Behary. I'm speaking in the couples track today, and I will be presenting schema therapy for couples who are dealing with issues of hypersexual narcissism. As if dealing with couples isn't tough enough, dealing with narcissism isn't challenging enough, and then we add that extra layer of hypersexuality. And truthfully, it's quite hard when we work with issues of trust violation, restoring trust, dealing with financial infidelities, sexual infidelities, all types of betrayals that can lead to trauma for partners who are on the receiving end of this, and certainly hardships like shame and humiliation, embarrassment, remorse, empathy, those challenges for those who have actually offended the relationship or broken the trust. And then there's that element of narcissism. And when we add the element of narcissism, we now have an individual who also brings to the table a very low empathy and a very high sense of entitlement. So you end up with defensiveness, justifications, rationalizations. And yes, at the core of that, as you will see and hear today, there are issues of shame. There is a wounded child. There are explanations for how this hypersexual mode develops, how it evolves over time, how it continues to create problems, a self-defeating pattern in relationships, how it affects the relationship in pretty profound ways, and how difficult it is to be able to get past this issue in couples treatment. Not impossible. I have worked with narcissistic individuals for more than 30 years. I've worked with couples just as long. Many of the couples I treat have issues of narcissism, and many of those have hypersexuality or some form of betrayal, trust violations in their relationship conflict as well. So we have a lot to cover. This is an abbreviated session. If you'd like to learn more, you'd like to hear more, of course, go to the Schema Therapy website. Go to my website. You can find that in the handout. You can find that at the end of my slide presentation. So here we go. Let's get started. Okay, so we are treating couples with issues of hypersexual narcissism. And in schema therapy, of course, we always look back to begin to understand the story. We want to understand the childhood origins when it comes to challenges like narcissism and developing what we would see kind of in the vein of a self-stimulating, self-distracting, self-soothing mode that often in the background for this individual, you have a parent who was either very strict or a parent who was not setting limits and was just too indulgent or too permissive in the way they parented the child. And so the child's capacity to deal with frustration and learn how to tolerate it, learn how to live in the world where the reality of discomfort is, always present. That possibility is always present. We say that the child was not really prepared to live in the world, to be uncomfortable, to deal with frustration, to regulate their system in a way that's healthy and adaptive. And so they've turned to different drugs of choice. Some may use food, some may use alcohol, some may use sex as a drug of choice. And narcissists, of course, because of that need for approval and specialness and recognition and to be extraordinary, can, at a very early age, begin to engage in these fantasies of grandiosity, of super desirability, and that can often fall into the realm of their sexual identity, their sexual desirability. And the experimentation, the curiosity about sex, that's not so unusual for a coming of age adolescent. It's the excessiveness, the preoccupation, the use of this more as a medicinal component for loneliness, for overriding maybe very strict parents or the chaos of having no limits and no real sense of stability in their lives. That's where the problematic behavior often arises from and then begins to emerge over time. Sexual history can reveal, as I said, this preoccupation or fantasy, and it can act as a kind of pleasurable companion because sex is pleasurable, right? And so it can become somewhat addictive for the individual who is really, feeling very alone, feeling very unseen, or has the burdens of super high expectations placed upon them where their lives are incredibly stressful and there isn't any room for just being a child, with the ordinary needs of a child, the ordinary emotions being expressed. That fantasy, as I said, of desirability, of superpower, of control, and it is a stimulating distraction from all that may be distressing in the life of the child. This is what we find when we begin to investigate and we look back. And when we're talking about covert narcissism, or the vulnerable narcissist, as they are sometimes referred to, we're thinking about a child who often does have a bit more trauma in the history. And so, a way of escaping, distracting, detaching from traumatic episodes or the aftermath of them can be through this drug of choice. Of course, on the other side of hypersexuality, in a relationship, you have the partner who is now the recipient of this information, who has made the discovery, and who is now finding out about their spouse's infidelity, their secret life. They may be finding out about other things. It could be drug use, it could be gambling, it could be spending their children's college funds. It could be a number of things that would cross the line, that would interfere with this thing called informed consent, which everyone wants to have in their relationships in order to have a secure sense of trust and connection, that whatever information I have is accurate and up to date, and therefore I give consent to spend my life with you, essentially. So it's a major violation. It's not a small issue and can lead to actual traumatic response. And as you look at this list of bulleted items, it's not surprising that most of it looks like PTSD, right? Because it is a form of post-traumatic stress. When we have betrayal trauma, this sort of vigilance, feeling overwhelmed, can have flashbacks, can have a lot of ruminations about what happened, how did this happen, somatic symptoms, etc. One of the leading experts in the area of betrayal trauma, since I'm not going to focus heavily on that today, is Dr. Jill Manning from the USA. That's her website, and she has a whole host of amazing, beautiful resources there. So if you're interested, have a look. And as I said, a lot of this can look very much like PTSD, can be very destabilizing to one's social schemas. And research has shown that betrayal trauma can be associated with more physical illness, anxiety, dissociation, depression, than traumas that are lower in betrayal. And I think the reason for that lies here in this irony that exists in betrayal trauma. So when you think about it, when you are living with someone who is your refuge, your home is your sanctuary, your partner is your safe other, the person you feel the most secure with. You have been, let's say you were assaulted, you were mugged, you were mistreated in some way by a stranger on the outside. You've had a car accident. Any other stranger trauma outside of your relationship can be met, if you're lucky, can be met with the comfort, the safety, the security of that home base of your partner, your primary partner, the one who, will wrap their arms around you and provide that comfort, will provide that reassurance, will protect you. And often there isn't the sense that it's going to happen again and again, right? It's happened, and there may be fear that it could happen again, but it's not likely to feel that way within the confines of your sanctuary, right? The problem with betrayal trauma is that the partner is the perpetrator of the trauma. And so this can cause extraordinary vulnerability during a time when there is such a need for comfort and stability. And then, of course, there are many triggers that can occur. Just electronics, iPhones and iPads and tablets and laptops and things like travel, disappearing, anything that's associated with the offending partner's betrayal, their expressions of joy, anniversary of something, a season, a smell, a sight, a sound can trigger. As we know, triggers are very sensitive to our sensory experiences, and that's not limited when it comes to um, problems with betrayal because of hypersexuality or sexual addiction. So we go back to the universal attachment questions when it comes to a primary relationship. What are these universal attachment questions that we all ask ourselves when we're engaging in a relationship or we are assessing our relationship with another? Can I count on you and trust you? Are you there for me? Will you respond to me when I need you? Do I matter to you? Am I valued and accepted by you? And of course, all of these statements become negated or called into question, put on pause, you might say, when there has been a violation of trust. Victims feel trapped and often need to remain in the relationship out of necessity, finances, children, religious, cultural issues. And so the fear of a reoccurrence is escalated, more so, as I said, than with random or accidental traumas. And other things just to consider, as I said, I'm not going to get too deeply into this, but I want to give you just a basic sketch of what it looks like on the other side of the relationship that you are now beginning to engage in for treatment. The underlying schemas and modes of the offended partner can certainly lengthen the healing process. So if you have someone who already comes to this experience living with a hypersexual narcissist who has now, they've now uncovered this betrayal, they've uncovered a history of pornography addiction or infidelities or sexual encounters with strangers or even emotional affairs. Once this gets uncovered, if that offended partner, or what I'll call the victim of the betrayal, is now bringing also with them underlying schemas from early life experiences, perhaps feeling defective underneath, perhaps always being the one who has subjugated their voice, who has quieted their own opinions, who has sacrificed their needs, the one who has lived in fear of abandonment, when these schemas, which are all likely to be activated in the face of this type of discovery, when they get activated, it makes the process even harder, right? Because there's so much more lighting the flame underneath what is already occurring in the here and now. The offending partner can employ a great deal of gaslighting during these active years and even after this discovery. So we know narcissists are quite famous for getting their partners to be somewhat coercively controlled and believing that they're crazy. I don't know what you're talking about. You're paranoid. You're so insecure. You always think the worst. You just have no capacity to trust. This is all because of your father. I don't know. I would never do such a thing. So narcissists are very good at kind of pulling the wool over someone's eyes, very good at getting partners to doubt themselves. And again, if the partner already comes to the relationship with a host of schemas that are likely to put them at risk for doubting themselves, doubting their own rights, doubting their needs, doubting their sense of worth and value, it's not that hard for them to be convinced when the narcissist does this whole performance, if you will, on how incredibly loyal and faithful they are and how crazy the partner must be for even thinking some things. The shame of sexually acting out on the part of the narcissist, losing money, can also be transferred to the partner in most circumstances in the form of blame. So even when they do have to come to terms with accepting that they've been found out and there's no escaping that, then it quickly gets turned to, well, how could you blame me? You don't take care of yourself. You don't show interest in me. You are you're not very sexual. You have lost interest in your own body. You're constantly nagging me and trying to control me. You don't give me any space to breathe. So there's a sense of I'm entitled to do what I did, and it's your fault that I did it. You drove me to it. Is it possible to repair trust in situations like this? Is it even possible? And the answer is, well, it is possible, but it's hard. And it's hard because it requires some very essential ingredients in order to make this happen. As I tell so many people who come to consultation with me on this very issue, as I've told couples who have consulted with me on this issue, as I have shared with colleagues on this issue, it is very difficult, if not impossible, if you don't have three of the essential ingredients. And one is, as always with narcissists, there has to be leverage. There has to be something meaningful, some kind of a consequence that they don't want to face that's going to bring them to the treatment room and sustain them in the treatment room, right? That has to be in place. You have to have a model like schema therapy, which goes deep, deep into the dark waters, really explores, really excavates, really looks at and makes sense out of how this personality was developed, how these modes were constructed, tries to understand and begin to mitigate the shame, the very toxic shame that lives in the skin felt experience of the narcissist, but at a very deep and unaware level. So, a deep focused approach is absolutely mandatory for change to occur. And you have to have a therapist, number three, who is sturdy enough to be able to manage their own schemas and modes, because working with narcissists anytime can be incredibly triggering. And then you add hypersexuality, which to many therapists can be very uncomfortable. Just talking about sex alone can be uncomfortable, but oh my gosh, very necessary if we're going to work effectively with couples. And so therapists get triggered. So we have to be sturdy. We have to be able to do the hard work, to confront, to hold them accountable, to ask the hard questions, to be able to, again, dive deep and connect with that vulnerability while also caring for this partner who is now living in fear of, well, what next? What else don't I know? What can I trust? What can I believe in? When will I feel safe? How can I give credit for good behavior when I'm so fearful that it's all going to just melt away again? How do I know that this is sustainable? So there's a lot on the table, right? You sure you want to do this? We ask ourselves. Um, so the partner really has to develop a thorough skin felt understanding of the self-destructive nature of this hypersexual mode, this part of their personality, if you will, that was originally constructed to protect, to stimulate, distract from these painful early life experiences before they can dive into the skin felt suffering of their partner. So we have to dissolve the bad guy. So when people say, is trust possible? I say, well, it's possible, but the narcissist is not going to be able to fully empathize, to fully remorsefully apologize, and really get what's happened to their partner until they can care for and dissolve this need to defend the bad guy that they feel underneath. Let's face it, they're smart enough to know that this wasn't okay. This was behavior, as much as they may defend and deny it, this was not okay. And obviously, it was not okay because they kept it discreet. It wasn't shared, it wasn't open information. And they'll say, well, I did that to protect my partner. It would have been too hurtful. Well, yeah, maybe. But oftentimes we need to help them to realize you did this to protect yourself too, because you didn't want to face what was likely to happen, which is this, right? The conflict, the chaos, the hurt, the suffering, the sense of feeling bad, and the possibility of a termination of your relationship. Partners, partners, the offended partners can be emancipated from self-blame, from anger, from this perpetual punishing and self-doubt. They too have to engage in a thorough understanding of the narcissist modes. They have to understand their own, of course, too. What else may be interfering, what old life experiences, schemas, and modes that they bring to this experience are also getting tangled up in the conflict. But they really need to understand the modes of the narcissist so that they can begin to see, I mean, this is what will help to resolve and minimize the mode clashing that continues to happen, right? And this inability to give any positive recognition as treatment is going on to good behaviors as they occur. I call it a bit of a phenomenon, right? Where the partner who is so feeling so unsafe and so mistrusting and may also be slightly on a mission to now punish the narcissist for the rest of time. Of course, we know that's not going to work. They're so terrified that if they give any feedback that's positive, that they're going to be played the fool again. And this is just going to happen all over again. And the narcissist will be like, I'm off the hook. I'm done. I'm free. I'm good. So instead, they abstain completely from providing any positive feedback. And we teach them how it's possible to use the voice to both acknowledge the recognition of positive movement while still being cautious in their optimism, right? So it's a kind of empathic confrontation where I understand that you're really trying, and I can see that you're making an effort to be more present, to be paying attention to the triggers that are happening in me, to be more aware of the experience and how I have felt it, to be more aware of yourself, to really be doing the work that you need to do. I'm aware that you are committed to this, and I'm grateful for that. But confrontation, but I say that with a lot of cautious optimism because there's still a strong part of me that is afraid that you will hear that is as we're good, we're done, and we're not done. There is still a lot of work to do, but I do want you to know that I'm noticing. I am paying attention. And this is necessary, right? They're both going to be able to meet each other's needs at a core level when that recognition, that identification of movement in a positive direction is occurring. As I said, underneath all of this, we have to dive deep to get to the shame and to get to what becomes ultimately a toxic shame. The narcissist doesn't carry just the kind of what we would think of as adaptive shame, a parent who in their efforts to discipline a child in a healthy and productive way will help the child to realize that when they've said something that was hurtful, that was disparaging to another child or to another individual, when they've done name calling or bullying, parent will engage in helping the child to feel some sense of responsibility, which will result in a type of shame about the behavior. And we'd call that adaptive, right? The ability to be responsible, even though it might be embarrassing, it might be uncomfortable. Unfortunately, for the narcissist, that shame is not typically delivered in a way that is careful, thoughtful, adaptive. They've experienced it in a way that becomes toxic. In other words, you're bad. What's wrong with you? How could you need that? You're so weak. That's pathetic. And it's not necessarily attending to their inability to be respectful of other people's feelings or experiences. It's more about their emotional expression. So the narcissist gets a lot of toxic shame centered around the way in which they express emotion as a child. It's too needy. You're so selfish. You're so weak. That's pathetic. You shouldn't need those things. You shouldn't be afraid of such things. You should know better. It can feel very toxic. It can feel like an assassination of the soul, right? A real demoralizing of one's just sense of self in general. And again, remember, with covert narcissism, this is harsh. This is what many of us would think of as occurring with BPD, but it can also occur on the spectrum of narcissism when we think about the more vulnerable type who will suffer from this level of shame. And so to override that, to bypass that, although they may have more capacity to be task focused, to be achievers, to be performance oriented, and to do well in many cases, their ability to interpersonally relate in an effective way is fairly impaired. And their need to soothe themselves because of all the loneliness and that lack of connection that is necessary can sometimes land in a sexual preoccupation or a hypersexuality. Our guidelines for the treatment room when we're working with a couple of this sort is we have to start with a safe laboratory. So my space, my treatment room, this is a safe place. This is a safe laboratory. This is a place to learn, to grow, to discover, to be curious, to fortify, to transform. We talk about needs versus wants. We look at the reality when it comes to goals, how much is too much, how much is unrealistic in terms of what they're both envisioning when we ask those central questions like, what would it look like to you if this were a success? What would it look like on the day you wake up and you come to therapy and you say, Wendy, we're doing well. And here's what's happening in our day-to-day life. What would that look like? So we want to get up close and personal look, a very specific look at how each of them might define that success in treatment. Decide if this is even realistic, and then attach to that whatever therapeutic goals are necessary in order to make that happen, like the diminishment of these maladaptive modes, a deeper understanding of schemas, a weakening of schema activation, quicker recovery. We look at and we discuss respect and reciprocity as a guideline for the treatment room, right? The challenge of being able to speak without hurting the other. So speak on behalf of yourself, speak on behalf of your anger, your frustration, your disappointment, your joy, your sorrow, whatever it might be, but without assassinating the character of the other. And most importantly, this should probably be right up at the top, we look at the reasonableness of individual versus conjoint sessions. In my experience, if the narcissist in this relationship has not had any individual therapy, it's going to be very important that they have individual work going on, probably even before the conjoint work can begin, or at least in a side-by-side fashion. I like kind of managing the system when it's possible, and I recommend therapists who can do it. This is time and this is money for the couple. It is costly, but when they can do it, that there be a way to orchestrate it so that they are both getting some individual work done, and you have intermittent conjoint sessions just to get a look at them together and how they're relating to one another. I want to keep the partner involved because I need a truth teller, right? If I believe the partner is stable enough to be a truth teller. We also have to assess, partner stability and background and what they bring. Partners, either one of them may be in other individual therapies outside of your treatment room, but I would highly recommend it be someone like a schema therapist, so that you know that the deeper work is being done, and perhaps someone that you even can be in consultation with their permission, so that there is more transparency around the work. We manage expectations, as always. What is it going to look like? Defining success, ownership, responsibility, timeliness, payments, etc. Really important because narcissists are notorious for ducking out of therapy, for being too busy, for having other commitments, for showing up late in some cases. Not all of them, but in many cases where they are going to be in the face of shame, there will be something that somehow gets in the way. And so you have to be very clear about your expectation of timeliness, commitment, consistency in treatment. And, the perils of not having consistent therapy, what that can look like over time when there's a lot of fits and starts. We know that it doesn't work. And there can be, a kind of resignation that therapy doesn't work, therapy doesn't make a difference, when in fact they haven't really been in therapy because there's been too much interruption. So, schema therapy, here we go. We're correcting the biased emotional experiences. We do this with individuals, and when we're working with couples, we're looking at each member of the relationship and at their individual schemas and modes, their early story, their early life experience. We're looking at this little child and the narrative that they've brought into their life cycle. And for those of you who are listening to this and are not familiar, although you may be by now if you're following World Schema Therapy Day, this is an integrative, evidence-based psychotherapy model offering effective outcomes with difficult treatment groups. It was, of course, founded by Dr. Jeffrey Young, and, and that's what we're talking about. The three major schemas that may activate a hypersexual mode. Now, there are many schemas that can activate hypersexuality with a narcissist, but three of the major schemas that play a role in hypersexuality with narcissistic clients would be defectiveness shame. That would be one for sure, that need to be accepted emotionally, physically, to feel lovable, to feel desirable, without having to prove anything, without the risk of rejection or judgment. Well, that makes sense, doesn't it? You have a narcissist who's engaging in multiple affairs or they are addicted to pornography, and that makes sense. It's all about you, right? It's all about self-pleasure. It's not about the needs of the other. It's not about eye contact. It's not about intimacy. It's not about emotional connection. It's just about pleasure. And you can do it on your time, at your pleasure, at your convenience. And if you're paying for it, well, you're paying for it. So you get what you want, right? You get whatever you ask for. There's no real burden of responsibility on the part of the narcissist, and that's very befitting with their personality. Emotional deprivation schema, of course, is very core to narcissistic personality disorder, the need for unconditional love, right? This is a missing piece. Like defectiveness and shame, emotional deprivation is another core schema, that need for love, affection, emotional nurturing, which was not around in their early experience. It can create a kind of boredom. So narcissists are also known for using expressions like, I was just bored, like it just wasn't exciting. My life hasn't been exciting. It's empty. And when they don't have distractions, the risk of being in touch with that vulnerability, which they will quickly label as boredom or emptiness, is a high risk factor for then engaging in these discrete behaviors like hypersexual behaviors. Enmeshment schema may be surprising to some of you, but again, when we think about covert narcissism and that kind of manipulation, that kind of having to be what the parent expected, the parent living vicariously through the child, the parent imposing their own identity on the child, so there was no capacity to really develop a self. That need to split sex from closeness, since the latter causes emotional distress within the context of schemas and that loss of self. This is another activating piece, feeling what they would call a suffocation from someone getting too close, wanting too much from them, expecting from them, causing them to feel guilt, causing them to feel shame, can lead them to actually perpetuate the guilt and shame by going into a sexual event. So it's the perpetuation of schemas, the very thing that they're trying to avoid, whether it's feeling defective and ashamed, whether it's trying to get that emotional need met or not feel it by steering away from vulnerability, trying not to feel the suffocation of over-attachment and that responsibility to be emotionally engaging or intimate. All of that leads to the very thing they're trying to avoid, which means distress and shame and a sense of worthlessness in the end. So, in terms of modes, we have this detached self-soother, we have this overcompensating, entitled approval-seeking mode, this lonely, shamed, impulsive child at the core, this demanding and devaluing internal critic, and a healthy adult mode. This is typically what you're going to find in most narcissists anyway, but it will certainly be true with an emphasis on the self-stimulator mode when we think about the hypersexuality. And if you think of hypersexuality as a mode itself, it would largely be in the context of that need for approval because there's grandiose fantasies often associated with the sexual activity and stimulation and distraction, so elements of detachment. So we think of it as a kind of detachment merged with an overcompensating mode. You see a little bit of mode merging there. So the detached protector and the narcissistic partner, the overcompensating mode, the demanding, devaluing critic mode, as I mentioned, these would be typical coping styles when you're looking at the partnership of the couple. So if you keep that in mind for a moment, and then we go to the betrayed partner, we find that they may carry with them this more compliant, submissive, passive, guilt-driven surrendering mode. They give in easily to whatever they're being told about themselves. Their child mode may be just infused with abandonment, abuse, loneliness, feeling unlovable. And of course, there could be an angry child under there too. There usually is. Their own critic, self-blaming, self-doubting, right, which allows them or allows the narcissist to continue to engage in behaviors as they please until the discovery becomes unavoidable. And plus, the partner may also have detached and overcompensating modes, right? Avoiding confrontation, avoiding engaging with others for support because it's just too humiliating. And when under pressure, they may become attacking, blaming, erupt into anger, or sometimes the angry child may also show up in these cases. As in the case of, we'll call them Joe and Linda, where just very quickly we have on one side Joe with his entitlement. He has this impulsivity that led to massive amounts of betrayal and sexual acting out, a lack of remorse, a lack of empathy. Again, very typical with issues of narcissism, limited accountability, approval seeking, criticalness, blame, anger, internal demanding critic, and then kind of martyrdom. He's the victim. Like I do everything. I get no appreciation. I give and I give, and I'm never recognized or really appreciated. What do you want from me? What can you expect from me? I mean, what am I supposed to do? I'm just a human looking for some reasonable attention. Okay, so maybe I went a little bit too far. I mean, cut me a break. It's like I'm the victim. I'm the victim. I'm the one. And at some level, at the level of a child, there's truth in that perhaps this child never really was appreciated or recognized or guided or shown any sense of value or worth. Expectations may have been large with very little praise that followed, or inadequate amounts of praise, certainly inadequate amounts of unconditional love. So there's a truth that deep at the core, deep in the basement of this experience, but certainly not right here. Although this is the battle cry that you're going to hear from the narcissist. Whereas with Linda, you have someone who's highly submissive, right? So she has more of a compliant surrender. She self-sacrifices, she subjugates, she loses her voice, she resigns herself to this kind of hopelessness. She becomes regretful about things she has said and done that she believes may have provoked him into this behavior. She also has resentment, right? We swing the pendulum to the other side of self-sacrifice and we end up with resentments and anger. She has a loss of her own self, a loss of her rights, voiceless, mistrusting, self-blame, fear of judgment. So you can see what we're up against. And we can see how it's the perfect dysfunctional fit in many ways until it's unsustainable, until it becomes unbearable. And that's often the case in the discovery of the hypersexuality. And with narcissists, it often goes like this. It's the D words in the English language, right? Deny, I didn't do it. You're crazy. That's not me. Defend it. Well, I mean, there's a lot of reasons. What do you want from me? I mean, I work really hard and I kind of stumbled upon it. And I mean, this is what all men do. Or in some cases, it might be the woman and she might come up with her own slogan for why this is perfectly natural in defending herself, devaluing the other. So here's where the blame comes in. What do you want from me? You caused this. You don't take care of yourself. You don't show interest in me. You don't appreciate me. Create distractions, right? Try to change the subject, talk about something else, or just disengage. Walk away, stomp your feet, slam the door. I'm not talking about it. How long do I have to do this? How many times do I have to say I'm sorry? I said I'm sorry. Okay? I'm a jerk. I'm a fool. You want to just shoot me. What do you want from me? To which I often say to my client, well, that's all about you. That's all about you. No, it's not. I said, I'm sorry. I'm sorry. Okay. I said, I'm a jerk. I'm an idiot. What do you want from me? I said, yeah, that's all about you. There's nothing in that apology that speaks to the experience of your partner. Nothing in there that can try to appreciate what it was like for her the day that she found this on your laptop, the day that she found the box of receipts for the hotel rooms that you tucked away carelessly. There's no appreciation for what that might have been like for her and how she carries that within her and how she carries that sense of mistrust of what else doesn't she know and how can she know when it's the right time to really count on you. So that's not really remorse, Joe. That's not really remorse. That's you in many ways just trying to get off the hook because this is so uncomfortable for you. This is so uncomfortable for you. And unfortunately, you have not been well trained, well versed in the capacity to tolerate this kind of discomfort, frustration. There's a lot there for us to explore. So this would be the empathic confrontation. Like, I get it. It's hard for you. It may not be your fault, but it's going to be your responsibility to figure this out so that you really can kind of sit in her skin and know what it's like for your partner to be on the receiving end of this. It's a big chunk of the work because you are going to get this revolving denial, defensiveness, and devaluing, distracting, disengaging kind of language. There are 5 critical questions when we are addressing the victim mode in covert hypersexual narcissism, because what you're going to get so often when you are working with the narcissist on their side, right? Let's say you are able to do some individual work with each of them, some intermittent work with them conjointly, eventually bring them in as a couple when they are ready. But what you're doing when you're working with the narcissist is trying to bypass this pseudo vulnerability, this what I call this identity that they have formed. This is their extraordinary identity, and it's called I'm the victim, right? It's poor me. I'm the super sufferer. I'm the martyr. I'm the one who carries all the pain. I'm the one who's not recognized. I'm the one who's not appreciated. And when you, the therapist, begin to embark on trying to empathize with that, to validate that experience and what that's like for them, they push you away. No, no, you don't get it. You couldn't possibly understand this. You don't know what it's like to be me. I mean, I can't imagine. I'm not saying I'm perfect. I'm not trying to brag. I'm not trying to be a show off. But Wendy, you couldn't possibly understand this. I mean, it's bigger than anything you could imagine. So it's always too big, too superior, too special, too extraordinary that we can't touch it, right? We're trying to get close to the real vulnerability underneath. I mean, they may even be tearful. They may sound emotional, but this is performative. This is why it's sometimes called pseudo vulnerability, or what I call this identity, this very special identity. It's not the special identity like a grandiose narcissist, the more classic type. Their special identity is all found in their achievements and their fancy cars and their expensive clothes and their big houses, their luxury vacations. They want to tell you about everybody they know who's a very important person. The covert narcissist gets their specialness very often in their suffering and in what they feel they were entitled to in the way of greatness, but why it fell short and it wasn't fair. And I should have been so much more. And I could have had so much more because I am so talented, right? So there's a kind of pitiful edge to this identity. And we can get deeper to the real vulnerable core if we ask these 5 questions. If we stay with what is it you really want me to know? Like if you take a moment and you just notice as you're telling this to me, what is it like for you? What are you noticing in your body right now? What would you want me to hold in my understanding of your experience? I mean, if you could whittle it down to just a couple of words to describe this deep emotional feeling deep within. No, deeper, Joe. No, no, no. Deeper than that. What would it be? What is the feeling that you notice in you? And he says, well, it's just like a really strong ache in my body, in my like in my gut. And I don't know, it feels very lonely, feels very sad. Okay. Wow, okay. I got that. I'm sensing that. Can you stay with that for a moment? I know it's hard. Just stay with that. That's important. This is important, Joe. You've just uncovered something very important. That sadness, that ache in your gut. Is there anything familiar about this? And here's where your affect bridge can be formed. So something familiar about that. Tell me what you notice about that that feels familiar. There's a story there. I bet there's a story there. What do you notice? And we can begin to build the bridge to a little imagery to assess, to see, to connect with that vulnerable child, to do the work that we do as schema therapists. The narrator voice is another form that we can use when we are in an empathic stance, when we are noticing, when we are struggling, even as a therapist. We're making sense out of what's happening in the moment, both as the participant in the interaction and as the observer of ourselves, the observer of the interaction. So we empathically confront and navigate resistance. We bring voice to the voiceless. We identify these, what I call acting out of frame responses. And it goes something like this, like, I'm so aware right now as I sit with the two of you, if you're sitting with the couple, let's say, I'm so aware that there's a part of me that feels this incredible, helpless frustration at times. And this is one of those moments. I'm feeling it. Like I can sense the great urge to want to make this better and the tragedy of everything that gets in the way and creates an obstacle for the two of you. It's like both of you can't get out of your own way. There is an absolute grip, like you're held hostage by this truth that has been created about what's so, what is. And that grasp is so tight, it's almost, if you really pay attention to it, we could probably all feel this sort of suffocating sensation in the room. Right? So the narrator kind of brings this story to life in ways that are not so apparent in the moment when there's a lot of content that's being delivered. We're aware of the process, right? Look, this is very hard for me to tell you, I might say. This is very hard for me to say because I care about you and I know you've been through so much and I know it's so hard to trust. And I know that you are fearful that if you say anything that sounds hopeful or positive, that he is just going to go right back to those bad behaviors. I get that. But without that, I just fear we can't move forward. I just fear that any good action is just going to be, it's going to fall apart because we all need that. Right? We really all need that, Linda. Right? And as I say it, I'm aware that that hurts you, that upsets you, right? You can feel some. So I keep talking also not just about what has to happen, what needs to be, what I'm noticing, but what I'm also noticing in myself as a way of continuing to forge that bond of care and connection with her in our therapy relationship. This narrator voice also helps us to identify this acting and reacting out of frame, right? I always say it's like entering the movie and you've missed the first three frames. You've come in where the couple is fighting, but you didn't see what led up to it. And unfortunately, couples develop this kind of top-down response system. We all get used to what we know. We know that that face means this, and when you make that face, it means that. And when you sigh, it means that. And when you say these words, it means that. So in frame one, you walk in the door. In frame two, you see a face and you respond to a face, a facial expression. And in frame three, it's how I feel about the way they've responded, right? the one who's been accused, how I feel about that. And by frame four, this is where you start. You detach, you defend, you give up. So, in other words, Joe walks into the room. He sees, that's number one. He sees Linda with, she goes like that. She sort of drops her gaze. She looks upset, but he doesn't see she's upset. He sees that she's about to blame him. I'm going to be accused again. Frame three. Here we go. She's going to start picking on me. Where was I? What did I do? Why am I late? Who was I with? Where was I? And here's where he begins his interaction with her upon walking in the door. What? What's that? Why are you looking at me like that? I don't have to put up with this. I don't need this. I'm tired of this. I'm not coming in the door to this face every night. This is ridiculous. I don't know what you want from me. And he storms out. So it starts, the interaction starts in frame four, but the top-down flow started the moment he walked in the door, and he begins to accumulate evidence of his rightness about this without exploring that sensation and working from the bottom up, asking questions, being curious. This is really important in the education of couples who are going through this experience. Really important when you're working with narcissistic types who are going to be so self-righteous about what they know, what they feel entitled to, what they will and will not tolerate, and that just difficult lack of empathy, that difficulty with empathy for the partner's experience. It's not looking at her or him and imagining the pain they may be feeling, the hurt they may be feeling, the worry they may have had when they've come in late. They don't have that kind of empathic, natural, attuned ability. That has to be honed, and that happens over time, as I said, with the inside out work. We are all kind of primed for pleasure. We perceive a threat, we depart from pain. It's kind of the way our brains are wired. So empathic confrontation or any confrontation can be very difficult to employ. But in schema therapy, when we use this essential element, what I like to call the golden nugget, and we employ empathy ahead of our confrontation as a prelude to a confrontation. It is so powerful in the way it can soften the edges, in the way it can help us to be heard, in the way it can reduce all of the minutia, all that unnecessary conflict and defensiveness that can come in a straightforward confrontation that doesn't take into appreciation how we know this individual, what we understand about them already. And again, with entitlement being such a powerful obstacle in the treatment of couples with hypersexual narcissism, this inside out approach and the use of empathy in your confrontation is going to be incredibly important. Look, Joe, I'm not saying you're a bad guy. I'm not saying you're a bad person, but you do have this mode that is worthy of an exploration because I know that if you saw someone else perpetrating any kind of a crime against Linda, against your partner, that you would rush to her defense. You wouldn't let someone else bully her in the way you are allowing this part of you to both bully her and to have hurt her in the way it has. So we really need to understand this. We need to make sense out of this. You need to get a grip on that part and decide what you want to do to best represent yourself in the truest fashion. Right. So really important to be able to try to bypass that kind of defensive and also counterattacking, highly entitled style of the narcissist. And for the partner, understanding narcissism really changes the dance, right? There's a kind of liberation when partners become more educated in what it means to be narcissistic, what narcissistic personality disorder really looks like. It can immediately liberate some of that self-doubt and self-blame. Doesn't mean that they are blameless, doesn't mean that they don't have any responsibility or accountability in the conflict. Of course they do. We know both partners play a role, but not necessarily a 50-50 role, right? It can promote self-reflection so they can begin to really look a little deeper at themselves and understand how they got kind of caught in that web of gaslighting, how they were unable to really see themselves and how their healthy adult really was held hostage for a period of time based on those early life experiences. can fortify a healthy, wise inner advocate that allows them to be more assertive, setting limits, holding the narcissist accountable, and can mitigate their own personal shame, reduce these narcissistic reactions, right? Mitigates the shame for the partner and mitigates shame within the narcissist because partners get better at being able to describe their own needs, at being able to express their own disappointments, at being able to express what is unacceptable and intolerable to them in a way that it can be heard. I know it's hard to imagine because you imagine the narcissist has such a block that can get in the way, but there is something very incredibly powerful, almost magical about the use of empathy with confrontation when it is done in a persistent, repetitive way. So we frame the treatment, we discuss dual therapy, we establish boundaries, transparency, etc. You can take a look at this. Um, there's a lot that has to be discussed as you're going into treatment with the couple that, what must happen. In some cases, it might be even a full self-disclosure that has to be done in order to create trust and safety, especially if there is a long history of sexual misconduct, sexual addiction, whatever you want to call it, hypersexuality. So there may be a need for a full-on self-disclosure. Some couples will engage in polygraph tests even in order to begin the process to establish a safe base because the safety is just so um, it's so impaired, it's so fractured. Okay, let me just stop the share for a moment. I want to take a look at okay, sorry. I just want to take a look and see how many more slides I have here to go through before we conclude, because I know I'm going to be running over my time limit with all of you. So I'm going to jump ahead a little bit. Some of these you can actually read in the handouts on your own. I want to go to these treatment strategies. So we identify, explore, we label the modes as they're coming up. We use empathic confrontation to address resistance and criticalness in treatment to weaken these modes. Integration of empathy and compassion for the lonely child once you are connected to that vulnerability will be important to understand how this hypersexual mode originated in their lives. We use imagery in the therapy relationship to nurture and meet the unmet needs like unconditional love, acceptance, praise, engagement in play, engagement in the identification of a self and natural inclinations. We use rescripting to strengthen the healthy adult, to learn how to care for that vulnerable child when they can experience what it's like to have a parent in their lives who's actually meeting those needs. We may recommend adjunct group therapy to help strengthen the empathy, accountability, remorse, develop true intimacy. And as with other compulsive behaviors, sometimes the self-help groups can provide help for some patients. It won't work for all of them, but certainly may be helpful to some. We have to address resentments with the partner who feels betrayed and recognize that there may be parts of them that end up in spy mode and they don't want to be the private investigator for the rest of time. They want to stay connected, but they have this critic that will beat them up for even staying in the relationship. They have a vulnerable part that just feels so hurt, resentful, betrayed, alone. And they may have a healthy part that realizes that they don't want to spend all this energy on just focusing on the narcissist. They need to put some of their energy into their own needs, to be hopeful about getting a sense of security for themselves, to know that finding their voice again is a success, whether or not the relationship lasts, that it's important that they reestablish that secure connection with self and to feel each part, to look at the relative strength and allow the healthy adult to hold them tenderly and compassionately the hurting parts and those desperate parts that want to, act as a spy while they're dealing with all of this insecurity. So we have to address the resentments that lie in the various modes that are going to be flipping as they're trying to find that stability and that sense of being, grounded in their bodies. And there will be obstacles, and a lot of these obstacles to treatment, I'll just jump ahead a little bit, will be the therapist not being comfortable talking about sex, not being comfortable intruding in the life of the couple when it comes to the history of sex or money, the therapist's fear of rejection from the couple or from the individual, identifying too strongly sometimes with a wounded partner due to personal experiences, and maybe being too detached to really do the work that requires us to be very actively engaged in empathy and confrontation. Maybe I'm just embarrassed when it comes to the details that are necessary for really helping a partner to heal, helping a narcissist to be able to tell their story without judgment. If you're someone who is very skittish or uncomfortable with that language, it may impede progress. So we have to fortify our own sturdy adult mode and therapy relationship to address anger that's going to come at you, to address criticalness that's going to come at you, because this is not just a hypersexual mode, this is a hypersexual mode attached to narcissism, which means that there is more likelihood of that kind of entitlement, defiant, detached protector, criticalness of the therapist. They don't have to necessarily have rage or outrage, but the anger can still be very uncomfortable. They can be snarky. They can put you in your place in their own aggressive and passive aggressive ways. And always good to employ the pause strategy when you feel uncomfortable, right? Take that moment to pause, to reflect, to restore yourself, to close your eyes, even if it's right in the middle of a sentence in the treatment, especially with the narcissist, but also with the couple. You are modeling for them that we can run interference between action and impulse. You are showing them that we can restore ourselves back to a healthy adult mode if we take a moment to breathe, to reflect, to put our little self in a safe place in our imagination, and to come back to the moment and to try it again, right? To restart that interaction in a way that might allow us to do it now through a healthy adult perspective. Don't forget pictures. Photographs can be very helpful when you're working with individuals as well as couples. They bring their photos together, they share their photos with each other, they tell their stories. You are doing everything you can to try to continue to make the empathy and the understanding of one another robust. This is not about feeling sorry for the narcissist or just feeling sorry for a partner who has been betrayed by a hypersexual narcissist. This is about a deep, attuned understanding to the story underneath that's going to create the obstacles in their capacity to heal. We're trying to promote attunement. We're trying to promote validation, empathic awareness. All of that is necessary if you're going to heal trust. And audio flashcards are maybe one of the most powerful agents you can use to keep the therapy alive. So your voice recording to them during the treatment, little tidbits, little snippets, little something that's going to call their attention to that moment for praise, for reenactment, for practice outside the treatment room, for anticipating a conflict that may be coming up, for helping them to maybe engage in a little bit of a strategy together, to engage in a strategy with their own vulnerable child, to provide support, to stay attuned, to monitor, to track, to notice the triggers in when they're about to go into a mode that's going to be self-defeating. So your voice guiding that process in an audio flashcard can keep that therapy alive, and it keeps the therapy relationship very well bonded as well. It takes time. There are complications of grief and regret in the aftermath of all this. We have to be careful about the narcissist going into euphoric recall of, how good it felt to be engaged in that drug of choice, and addressing resentments and regret as shame reemerges. Both of them will feel the shame, the doubt, questioning themselves, Maybe I should have shut the door. Maybe I should have gotten out. Maybe I'm a fool. There will be a lot of that even in the aftermath of this, and even in the aftermath of the work as it begins to take hold, right? Schemas are tough. Schemas are they get a hold on us and they don't want to let go. They want to breathe. They want to live. They are part of our hardwiring. And so they will not go away completely, but we do want to make them as dormant as possible. We do want to make them as soft as possible. We want there to be less frequency. We want there to be less intensity. We want to promote quicker recovery when there is activation. That is treatment success. So we have to make sense out of the story that can lead to liberation from this haunting melody of the inner critic that's going to drive things like shame and regretfulness and what are you doing and what were you thinking? And it's going to be this like constant hammer on the brain. And I think I have covered most of it in brief. Again, this is a very abbreviated version of the work that we do with this very complex population. So again, just some elements, just a basic sketch and outline of how it looks. If you are inspired, if you feel excited about this, if you are beginning to fall in love with schema therapy a little bit, or feeling like you have something that you can bring into the repertoire of your own work, don't hesitate to look for a little bit more. You can find that on the websites that I've shared with you. Take good care, everyone. I hope you've enjoyed this presentation, and thank you for being with me. Bye for now.